This is a video about the birth control side effects doctors brush off and why those side effects actually matter. You're 3 months into taking the pill. You're sitting at your desk at work, staring at an email you've read 4 times, and you can't make yourself care enough to respond. Your boyfriend texted you this morning. Something sweet, something that would have made you smile 2 months ago, and you felt nothing. You look down at your jeans, the ones that fit perfectly in June, and now they're cutting into your waist. You think, what's wrong with me? When you finally work up the nerve to tell your doctor, she glances at your chart and says, give it time. Your body's adjusting. But here's what no one told you: you're not imagining it. You're not overreacting. You're not broken. I'm Kayla, and this channel is a safe place to learn about your body. This isn't medical advice. Always consult your healthcare provider for personalized guidance. But it's a guide to help you find the words and the next steps you deserve. Here's the disconnect. Your doctor is trained to prevent the worst-case scenarios: blood clots, stroke, unplanned pregnancy. Those are the risks that show up in medical textbooks and malpractice lawsuits. So when you sit in that exam room and say, I don't feel like myself anymore, your doctor hears, not life-threatening, and moves on. But you're not living in a medical textbook. You're living in your body every single day. And when you can't remember the last time you wanted to have sex with your partner, when you're crying in your car before work for no reason you can name, when you've gained 15 pounds in 4 months and nothing fits that's not minor, that's your life. The side effects doctors brush off aren't rare. Mood changes and depression. Libido dropping to 0. Weight gain and water retention. Hair thinning. Exhaustion that sleep doesn't fix. Your body is running low on B vitamins, magnesium, zinc, something multiple studies have documented. And research from UCLA shows women on hormonal birth control process stress differently. Their bodies react more strongly to stressful situations. These effects are documented. They're more common than your doctor might admit. But they get labeled subjective or temporary and dismissed because they don't fit the medical definition of serious. Here's what you need to know. The research on these side effects is incomplete. It's underfunded. And there's a long history in medicine of dismissing women's symptoms as emotional or exaggerated. Your doctor sees birth control as a huge win. It prevents pregnancy, regulates periods. So they focus on those benefits and downplay the costs. But you're allowed to weigh those costs differently. If the side effects are stealing your quality of life, that matters. That's not dramatic. That's reality. Let's talk about what's actually happening in your body when these side effects show up. Because understanding the why helps you see this isn't in your head. You're lying in bed next to your partner. They reach for you and you feel nothing. Not turned off, not tired. Just blank. Here's why. The pill works by convincing your body it's already pregnant. When you're pregnant, your body doesn't need to ovulate, so it shuts down the hormones that trigger ovulation, including testosterone. Yes, women make testosterone just in smaller amounts than men, and testosterone drives sexual desire. The pill suppresses it because that's part of how it prevents pregnancy. On top of that, the synthetic estrogen in the pill increases a protein called SHBG, which binds to whatever testosterone is left and makes even less of it available. The result? You might feel zero interest in sex. You start to wonder if something's wrong with you or your relationship, when really, your body is doing exactly what the pill told it to do. Act like it's pregnant. And pregnant bodies don't prioritize sex. You're at dinner with friends, someone tells a joke, everyone laughs. You smile, but you don't feel it. It's like watching yourself from outside your body. Here's what's happening. The pill contains synthetic versions of estrogen and progestin. These hormones don't just prevent pregnancy, they cross into your brain and affect how neurotransmitters like serotonin work. Your natural cycle produces progesterone, which your brain converts into allopregnanolone, a calming chemical that reduces anxiety and supports emotional stability. Synthetic progestins don't convert the same way. Some of them actually block that calming effect. So when you feel emotionally flat, more anxious or numb, that's your brain trying to function with different chemical signals than it evolved to use. It's not a character flaw. It's biochemistry. You step on the scale and it's up 12 pounds. Your genes don't fit. You're eating the same way, moving the same amount, but nothing makes sense. Here's what's happening. Synthetic estrogen tells your kidneys to hold on to more sodium, which makes your body retain water. You wake up and your rings are tight. Your face looks puffier. That's not fat, that's fluid. But some formulations, especially Depo-Provera, also increase appetite and change how your body stores fat. The data on pills is mixed, so doctors say there's no link. But mixed data means some women gain weight, some don't. If you're the one who gained 15 pounds, the fact that it's not universal doesn't make it less real. And if the pill is affecting your mood or energy, you might move less or reach for comfort food more often. That's not laziness. That's your body trying to cope with a hormonal shift it didn't ask for. You're exhausted. You slept 8 hours, but you're still tired. Your eyes feel heavy by noon. Coffee doesn't help. You're sitting in a meeting, and you can barely keep your head up. You snap at your coworker over something small, and immediately feel guilty. Here's why. The pill depletes specific nutrients your body needs to function. It lowers B vitamins, vitamin C, magnesium, zinc, and selenium. Why? Because the synthetic hormones in the pill require these nutrients to be metabolized by your liver. Your body uses up its stores processing the pill, and you're left running on empty. These nutrients support energy production, mood regulation, immune function, and stress management. If you're low, your body can't keep up. And it can take months or even years for these levels to normalize after you stop. That exhaustion isn't laziness. It's your body trying to function without the fuel it needs. New research from UCLA shows that women on hormonal birth control have measurably different immune and psychological responses to stress. What does that mean for you? When something stressful happens, a tight deadline, a fight with your partner, traffic on the way to work, your body's stress response is amplified. Your heart rate spikes higher. Your chest feels tight. Your jaw clenches without you realizing it. Your cortisol stays elevated longer. You feel more overwhelmed by situations that used to feel manageable. That's not weakness. That's a biological difference caused by the pill. These side effects won't send you to the emergency room. They're not life-threatening in the way blood clots or stroke are. So doctors don't prioritize them. But they affect how you feel every single day. And if you feel wrong in your own body, that matters. You're sitting in the waiting room, rehearsing what you're going to say. You've been on this pill for 4 months. Your mood is flat. Your sex drive is gone. You've gained 12 pounds. You wrote it all down in your notes app so you wouldn't forget. You're nervous, but you're ready. You sit down across from your doctor. You say, I think the pill is affecting my mood and my weight. She glances at your chart. These symptoms are pretty common. Give it a few more months. You feel your face get hot. You want to push back but you don't know how. So you nod and leave, feeling smaller than when you walked in. Here's what I want you to know. You don't have to accept that. Let me show you what advocacy actually looks like. You open your notes app and start tracking. Every day for 2 months, you write down your mood, your energy level, whether you wanted sex, your weight, how your skin and hair look. It takes 30 seconds. By the time your next appointment comes around, you have data. Not feelings, data. You sit down and say, my mood dropped significantly starting week 2 of this pill. My libido disappeared by month 3. I've gained 12 pounds in 4 months. It is harder for a doctor to dismiss a chart than it is to dismiss. I feel bad. You're back in that appointment. Your doctor says, mood changes are temporary. You don't back down this time. You say, since I started this pill, my mood has been consistently lower and my sex drive has dropped significantly. It's affecting my relationship. Is this a known side effect of this formulation? Notice what you did there. You didn't soften it. You didn't apologize. You stated facts and asked a direct question. That's not complaining. That's reporting symptoms. And if your doctor says that's not a side effect, you say, "Can you document that in my chart?" Sometimes that alone makes them reconsider. Because if they're willing to write it down, they're taking responsibility for dismissing you. Most doctors don't want to do that. Now let's talk about your actual options, because stay on this pill and hope it gets better isn't the only choice. You can switch to a different formulation. Not all progestins are the same. Some are less likely to cause weight gain and mood changes, while others might help with libido but can worsen acne. Your doctor can explain which type might work better for you based on what you're experiencing. You can also try a lower dose pill or a progestin-only pill if estrogen is the problem. Your doctor should be able to walk you through these options. If they won't, that's a red flag. You can try non-hormonal methods. A copper IUD has no hormones at all. It works by creating an environment that's hostile to sperm. It can make periods heavier and more painful, but it won't affect your mood, libido, or weight. Barrier methods like condoms or a diaphragm give you full control with no hormones. They require more effort and have higher failure rates if not used perfectly. If nutrient depletion is part of the problem, you can add a B-complex supplement, magnesium or zinc, while you're on the pill. That won't fix everything, but it can help with energy and mood. And you can stop entirely. Needing a different method or choosing to stop is not failure, it's self-advocacy. Your quality of life matters just as much as pregnancy prevention. If your doctor dismisses you after all of this, ask for a second opinion. I know that can feel intimidating. Questioning a doctor takes courage. But you deserve a doctor who listens to your whole experience, not just whether you're pregnant or not. Birth control is effective at preventing pregnancy. That's not up for debate. But certain side effects get minimized because they are not considered serious and because the research is incomplete or ignored. Your experience is real. If something feels off in your body, trust that. You're not being dramatic. You're not too sensitive. You're paying attention. Track your symptoms. Bring data to your doctor. Advocate for yourself. And know you have options, different formulations, non-hormonal methods, supplements, or stopping entirely. All of those are valid. If this helped you feel less alone or gave you language to use at your next appointment, share it with someone who needs it. Subscribe for more videos that take your health seriously. Your body, your choice, your voice.